Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, and as a part of the continuing medical education program as well as the health awareness program for the general public, I will be highlighting on facets on epilepsy, different facets of epilepsy. And today, an important question which arises in the minds of people who have got epilepsy: can I watch TV? This is a common question that is being asked by people who suffer with epilepsy. Well, I do tell them, there is, when you watch TV, you can get epilepsy. That is called TV induced epilepsy. It is a reflex form of epilepsy or a photosensitive epilepsy. Then you have to be very careful in watching TV. Otherwise, you can watch, provided your seizures are under well controlled with medication. For about 3% of people with epilepsy, exposure to flashing lights at certain intensities can produce seizures and can trigger. They are actually called as a photosensitive epilepsy. This is, for example, what are those triggers? It can be the TV screen or the monitor with flickering or rolling images, certain video games when you play, or the computer monitor flickering or rolling images, TV broadcasts, rapid flashes or alternating patterns of colors, or sometimes, even if you look out into the sky, suddenly, the sun rays which are shimmering through the trees, the branches of the trees and leaves, can in fact produce seizure. There is a natural light like sunlight, especially when it is shimmering or flickering through the trees and the leaves, that can actually produce. Even the Venetian blind which you have in the room at the curtain, that in fact sometimes sunlight goes through it and it flickers, can produce a seizure, especially for those people who are sensitive, photosensitive seizures. Now, the most important is to prevent it, especially for TV-induced epilepsy or even otherwise for people with who had suffering epilepsy but are well controlled. The ideal will be watch the television in a well-lit room to reduce the contrast between the light from the set and the light in the room. So, let it be a well-lit room. That is one. Reduce the brightness of the screen. That is the other one. Sit as far back from the screen as possible, maybe more than a meter. Use the remote control to change channels on the TV, so you do not have to go close to the set, which of course all of us are doing remote control now. Avoid watching for long periods of time and wear polarized sunglasses while viewing television to reduce the glare. Very important. And video games, when you are playing or you are playing on the TV, at least 2 feet from the screen, again in a well-lit room, reduce the brightness of the screen, and do not let the children play the video games if they are too tired. Take frequent breaks from the games and look away from the screen every once in a while, especially when you are looking onto a screen for 20 minutes, try to look at a long distance beyond 20 minutes, or just cover your eyes with your hand and then only for about 1 or 2 minutes, and then again be back, so that when you blink, you look at a further distance and blink, the tears will moisten your eye. So, blinking may facilitate. That is the one. Cover one eye while playing, alternate which eye is closed at regular intervals. That is another one. Computer monitors, use a flicker free monitor, use a monitor glare guard. You can actually put it on the monitor. Take frequent breaks from the tasks involving the computer. So, these are some of the precautionary measures that can be taken for patients who have well controlled seizures, and also for patients who have got photosensitive or TV induced epilepsy or video game induced epilepsy. So, you can have these precautions and you can comfortably watch the TV. There is no problem about that. Thank you very much.